Great. Okay. Welcome, everyone. Good afternoon. I hope everyone's been, if you have been taking part in the showcase so far, I hope everyone's enjoyed the sessions that they've been in. So I just want to start with a quick thank you to our sponsors. So without these sponsors, we wouldn't have been able to achieve any of this event. So we're really grateful to the support that they have given us. Welcome to this breakout session. It's called Building an International Patient Group, Achieving a Global Reach with Limited Resources. So in this session, we'll explore Gaucher's experience of taking their patient group international and then the importance of collaboration in this transition. So with that, I'm going to introduce our host, Tanya. She is the CEO of the International Gaucher Alliance. So I will stop sharing and pass on to you.
Okay, so first of all, just to say congratulations to Beacon on your international showcase, and thank you very much for the opportunity to present the work of the IGA today. I'd also like to say thank you for everybody for coming along to this session. And as Hannah said, I really hope that we can have like an interaction, good interaction. The way I thought we could run today's session is I'm going to spend the first sort of 10-15 minutes just introducing myself and then talking about some of the work of the International Gaucher Alliance. And then I thought we could open up the floor to have a discussion, ask questions, see if anybody else has got any experience or things of challenges they want to discuss within the group. So hopefully we can have quite a nice session together. So as Hannah said, my presentation is around the work of the International Gaucher Alliance. I think we all know that access to resources are very, very challenging for patient organisations and charities. For us as a global organisation, I think, and other organisations, once you become a global organisation, you have a responsibility. And there is a lot of expectation from the community for you to be there for them. And we have sort of positioned ourselves as the sort of go-to organisation for anything Gaucher, remembering we are a member organisation. So with that and the challenge of resources, that's what I'm going to talk about today, and hopefully that will inspire a conversation. But first of all, these are my disclosures. But first of all, I want to say that, you know, I'm no different to most rare disease patient advocates. So first and foremost, I'm a mum. And I was thrown headfirst into the world of rare diseases when my daughter Maddie was diagnosed with neuronopathic Gaucher's disease. And actually I'm celebrating my 25th year in patient advocacy, which is quite scary. But as we know, being diagnosed with a rare disease or having a child diagnosed with a rare disease is really devastating. And at that time, I felt very, very alone. And I've never heard of the disease before, like many of us. So I craved information. I wanted to save my daughter. I had loads of questions to ask, but I never accepted anybody saying no or nothing, could be done. So Maddie was born in September 1994, and she had 10 fingers and 10 toes. And for me, she was a healthy baby. You know, I went back to work very quickly, and, you know, she was really happy. However, when she was 15, 16 months, my life changed forever. And she was diagnosed at Great Ormond Street with neuronopathic Gaucher's disease, an ultra rare condition. And sometimes I wonder, or I don't really remember what my life was like before that happened, really, because since for the last 25 years, my life really has been about my family and the Gaucher community. So when Maddie was diagnosed, there wasn't really much information around. And actually, the textbook said death within a year. I just really craved information, and I was lucky that at that time there was a existing patient organisation in the UK for Gaucher disease. So I joined the board. All of the board were amazing people. They all had non-neuronopathic Gaucher's disease, so I could bring something else to the board. Having neuronopathic Gaucher's disease is very different to having non-neuronopathic Gaucher's disease. So I decided that actually what I wanted to do is I wanted to sort of create a community for people like myself in the UK, and I wanted to bring patients and families together. For me, the best way of learning and emotional support has been with other patients and families who are in that same position. These are people I would have never met in my day-to-day life had it not been for Gaucher, but they have enriched my life, and they are lifelong friends. Sadly, some of them are no longer with us. As there was no patient information, for me that was crucial. And it needed to be patient-led information about what was important to patients. So we created a community, and the community involved, doctors and other interested persons. And then in 1999, I organised the first ever family conference, and actually this year will be our 10th conference. And it's really where we all get together. It's less about the information, it's more about being together. And that has become, such a massive part of my life. So I was really lucky. Maddie's diagnostic journey lasted less than a year. We found ourselves at Great Ormond Street about a week after Maddie became ill. She was originally diagnosed with leukemia, but they soon found out after a biopsy that it was actually Gaucher's disease. And really by the beginning of February, she was actually given a management treatment. So it manages the systemic aspects of the disease, but not the neurological aspects. It became very clear to me that actually my diagnostic journey with Maddie was not the norm. And that I also realised that because it was an ultra rare disease, you needed, when you wanted to work in the community, to create a true community, you needed to go outside of the country that you lived in, and you needed to work globally. In 1999, I experienced my ever first international meeting in Greece. And it was here I decided to get involved in the work of the European Gaucher Alliance, now the IGA. And the European Gaucher Alliance had been in existence for about 5 years. And I wanted to, again, work with that group as a volunteer for the neuronopathic patients and families. Why did I want to do that? I had really enough on my own plate with Maddie, and actually had become a single mum as well at the time. But Maddie's diagnosis had really had such an impact on me. It really had robbed me of control, and I was not, because I wasn't able to take away her pain and the uncertainties of her future. So for me, I took back control by throwing myself into making a difference. Firstly, for Maddie, because I realised how lucky we were. For me, I wanted to make sure that everybody had somebody. They had that person who would be there for them, to not make them feel alone. And I thought maybe, I could be that person for some people. And give them hope. And just last week, the father of this little girl in Rwanda WhatsApped me this photo, and it was taken a few minutes after her daughter started her first ever infusion of treatment. I'd been able to support this family and get their diagnosis. and also access treatment through charitable access. And I'd been that family's person, and they now had hope. There was people that were my person, and I wanted to be other people's person. So that was my reason for getting involved in the sort of bigger community. So the EGA, now the IGA, as I said, was established in 1994, and it was established by actually 7 patient advocates from Europe. And in 2018, the EGA became the IGA, and we now have 57 member countries from around the globe. Like many rare disease groups, we do really have a limited resource. We have 9 wonderful board members who are all patients with GD1 or GD3, or their caregivers. We have 3 part-time staff and me as the CEO. Our board members, they're volunteers, as I said. They all lead patient organisations in their own communities. They have their own condition to manage. They all have jobs and a family, and they really, truly dedicated. And I think probably many of you on the session today will recognise yourself and other members of your community who also do an amazing job. So despite our growing membership in the IGA, we were really aware that there were still so many countries and patients with little or no information for support and everything. And you'll see on this slide here, this shows you where our member organisations are. And you can see that there are big gaps. And that's one of the things I'm going to talk to you about today, is how we try to fill those gaps. So in 2018, the EGA became the IGA, and this transition took about 2 years. And there were lots of anxieties in our existing membership over the proposal to become global, as there were fears that we would spread ourselves too wide, and that those countries most in need would absorb all of our resources. And as you can see, from this slide where I've put the arrows, where there were big gaps of unknown territory, these are potentially countries where there are lots of challenges, and we'll talk about those later. So how are we going to increase our sort of global footprint when we recognise that we really didn't have the resources? And when we're talking about resources, we're talking about people, but we're talking also about money. So in 2008, we decided to set up a volunteer project, which we called our Regional Manager Programme. And our regional managers, these were going to be patient advocates, and we saw them as our eyes and ears in the countries where we had no awareness of what was going on. We had no, there was no patient organisation, and we saw that as a way of increasing our footprint. Because, as I say, we had limited resources, this had to be a volunteer programme, and we were able to use social media and our member organisations to reach out and say we were looking for regional managers in various areas across the world. And we were really surprised. We were really successful to recruit young Gaucher patients, or young adult Gaucher patients. And the reason these people wanted to take up these roles, well, they wanted to give something back. And many of these volunteers had actually received treatment through charitable programs and realised how lucky they were to be in that situation. So our regional managers, we support them with training opportunities. We do have a formal agreement with them, and we do support them. So we decided, based on our sort of geographical vision of where our members were, where the gaps were, that we had sort of 5 target areas that we wanted to set up programs in. And you'll see on this slide, this is where we were in sort of 2018, this slide. So we're looking at really sort of Central America and Africa and around the sort of Asia area. But you'll notice that we also have a regional manager in Europe. And the reason that we did this is because there was a lot of anxiety in our membership that by becoming global, that although there was good patient advocacy in Europe, there was still a lot of challenges. So we made the commitment to have a regional manager in Europe. So we implemented the programme in 2018, and the first success we had, and this slide is a copy of a poster that we had at the World Conference in 2020. Talks about the regional manager programme, but highlights some work we did in Nepal, which came under one of our South Asia programmes, where we worked with some key opinion leaders from Europe, and we went into Nepal with our regional managers, and we did an educational program on lysosomal storage disorders diagnosis. We met with a few patients that we could find, and from all of that information, sort of undertaking due diligence to really understand the country, we developed a development plan for the regional managers to then help develop Nepal to increase awareness, look at opportunities for diagnosis, look at, empowering the patients. This work is still going on. Unfortunately, COVID did have an impact on the ability to take this program forward in Nepal. So in the last 6 months, we have been able to find a small amount of money because this program has now taken on an entity of its own for somebody to be a coordinator for 10 hours a week. And we have had a bit of a change around of where our countries are, our regions are, based on feedback from from the program after a couple of years. So we've now sort of rethought the countries, and we've been lucky enough to increase the number of volunteers. So in here, we've split Europe into 2, and we now have 2 volunteers in Europe. And we have quite a few volunteers in Africa. So our program is going well. We're still on a steep learning curve, but we have already made a difference, I believe. So we believe that this program is essential because even though we're 30 years down the road from treatment for the systemic manifestations of Gaucher's disease, there are still patients like this little boy in countries around the world where there is no patient advocacy, there is no rare disease awareness, or very little. There are no opportunities for diagnostics, and we know that if we can if we can get into these countries and that we can work in these countries with volunteers and with other stakeholders, that actually we can save lives. And this slide is of a young girl who, you know, this is the story because there has been increased awareness, because there has been access to diagnostics, access to treatment. This little girl who has type 1 Gaucher's disease is now going to school. You know, we feel that we can see more of this with our regional manager program. So at the moment, we're focusing obviously on Gaucher's disease with the International Gaucher Alliance. However, the model that we have obviously can be, you know, translated into lots of different diseases. But also what we're now doing is talking to other disease groups, because some of our volunteers have Gaucher's disease, some of them don't. So maybe we can use the same resources, you know, to just raise awareness of Gaucher, lysosomal storage disorders, and rare diseases. So just almost at the end now. So in 2022, we do hope to take our regional manager program into the Middle East. And we're lucky enough that we've already identified a family that have 2 children who we've been working with over the last couple of years, who want to give something back to the community. And they're keen to take on this role. So that's a sort of whirlwind explanation of the program that, you know, we have implemented in the International Gaucher Alliance, which really has made such a big difference to us being able to reach out to different parts of the world where really we don't know what's going on, and we need to work with people in those countries or neighbouring countries based on, you know, their knowledge of the country. Obviously, you've got issues like language, the cultural issues, and you know, really sort of start to understand what the challenges are, and who the stakeholders are, so that we can, you know, really make a difference to those Gaucher patients and their families. So that's the end of my formal presentation.